This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today. Welcome to the Global Men's Wellness. I'm Dr. Judson Brandeis, and I'm so glad you're here. Let me start with a question. What if you could stop cancer before it spreads, before it impacts your life, your relationships, your future? That's the promise and power of early detection in prostate cancer. Prostate cancer is the most commonly diagnosed non-skin cancer in American men. It's estimated that nearly 290,000 men will be diagnosed this year alone. But here's the key insight. Early detection can save lives, reduce suffering, and improve outcomes dramatically. And that's exactly what today's episode is all about. So what is early detection, and why does it matter? At the heart of it is the PSA test, short for prostate-specific antigen. PSA is a protein produced by the prostate, and elevated levels in the blood may signal something's wrong. Think of it like a smoke detector. It doesn't confirm a fire, but it tells you when to check. But here's where it gets nuanced. Not all elevated PSA means cancer, and not all prostate cancers are aggressive. That's why context, repeat testing, and individualized analysis matter. How does PSA screening work biologically? As men age, the prostate can grow and PSA can rise. But in the presence of cancer, those PSA levels may spike more sharply. Using the simple blood test, along with factors like age, family history, race, and other biomarkers, we can assess the likelihood of significant disease. Is PSA testing new? Is it effective? PSA testing has been around for decades and remains the gold standard for first-line screening. Large trials in Europe and the US have shown that regular screening, especially for men aged 50 to 69, can significantly reduce prostate cancer deaths. In fact, a study in Sweden found that just 23 men needed to be screened to prevent one death. That's a powerful impact. So why isn't every man screened? Barriers include a lack of awareness, especially in underserved communities, outdated beliefs about screening risks, and systemic limitations in insurance or provider access. Some men fear false positives or invasive follow-up procedures. Others just don't realize how common this cancer is, or how beatable it can be if caught early. What is the patient experience like? For most men, the PSA test is a quick, simple blood draw. If the result is abnormal, we repeat the test. If it's persistently high, we may recommend imaging, like a multiparametric MRI, or a biopsy, often using advanced targeting. Today, these tools are more accurate and less invasive than ever before. Many cancers we find are slow-growing and don't require immediate treatment, just active surveillance. Personalized urologic care matters. Each man is unique. Black men, for example, face a higher risk of aggressive prostate cancer. Men with BRCA mutations or a strong family history may also need earlier or more frequent screening. That's why I tailor care to each patient, using tools like genetic profiling, imaging, and risk calculators to guide decisions. So how effective is early detection really? When done right, it can reduce prostate cancer deaths by up to 50% in targeted groups. But more than that, it gives men control. It opens the door to less invasive treatments, better quality of life, and peace of mind. With the right data, we can avoid overtreatment and focus on cancers that truly threaten health. What's next in urology and early detection? We're entering an exciting era. Artificial intelligence is helping us interpret scans more accurately. Liquid biopsies and genomic tools are on the rise, and telehealth makes it easier than ever for men to connect with specialists. The future is about precision, giving the right care to the right patient at the right time. And why do I do this work? Because I've seen what it means when a man hears, "You have prostate cancer." I've seen the fear in his eyes, and the relief when we say, "We caught it early." I've walked with men through diagnosis, treatment, and recovery, and I know that knowledge is power. If you're listening and you're a man over 50, or if you have a loved one who is, talk to your doctor. Ask about PSA screening. Get informed. Because there is a better way. This has been the Global Men's Wellness. I'm Dr. Judson Brandeis. Thank you for listening. Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.